Hi friends, in today's video we will be describing anatomy of the pararectal space. Please understand the pararectal space is the space which is close to the rectum. So we are trying to describe this space here, close to the rectum. Obviously, to understand this better, let us just take a cut section here because we are going to look at the pararectal space when we enter the pelvis in this plane. So we already know that we have the bladder here, which is lined by the detrusor muscles. We have demonstrated this. Then we have the cervix, which is in close proximity to this. And behind, we will be having the rectum. Now, the pararectal space is obviously the space which is close to the rectum. Behind, as we know, you are going to have the bone, which are the sacral bones. So this is your sacral bone. All right. Pararectal space is basically the space which is adjacent to the rectum. So let me just outline this entire space for you, because here close to this you have the pelvic side wall on both the sides. So this is the pelvic side wall. But simultaneously we need to know the anatomy. So you have the external iliac vein which is going to cross above, and then it is going to give an internal iliac vein, and as we all know, the obliterated umbilical, which we have demonstrated, will continue above. The anterior division would give rise to the uterine artery here. As we are aware, it is the only curved artery which is entering in this plane. It may simultaneously also have the presence of a middle rectal artery, which I am just drawing here. This is an occasional presence, and then it has the pudendal artery. So this pudendal artery is going down there inside the pelvis. Whenever we are trying to look at the pararectal space, it is this space which we are concerned about. This is our pararectal space. This is what is concerning us. But we have a golden structure of anatomy, which is the ureter, and as we all know, ureter enters inside the bladder, water under the bridge, uterine artery is present above that, and the ureter is here. And simultaneously, in our previous video, we learnt the uterosacral ligament. Correct. So we have the uterosacral ligament, which is a fan-shaped thickening of the peritoneum. So what do you have here? You have the uterosacral ligament here. You have the cervix, which is present here. You have the uterine artery, which is present right here. Uterine artery. Of course, you have the ureter, which I have mapped, and then you have the rectum. So in this entire space, if you study, pararectal space is a potential space which is existing with uterine artery being its anterior wall here. Okay. Ureter is actually going to come and cut this entire space into two potential parts. The two potential parts being this. So you have two potential parts here. One is the lateral pararectal space, which is this, and then you have the medial pararectal space, which is this. So both these guys are going to be cut by our friend ureter. So ureter is a very important landmark in the pararectal space. In fact, the minute you open the pararectal space and you go down inside the pelvis, when you open the pararectal space and you go inside the pelvis, the first structure which you encounter is the uterine artery, and that is the clinical significance of doing this. Now, where does this anatomy of studying this help you? Like we have discussed multiple times, endometriosis. Now, endometriosis is one disease where the rectum goes and gets adherent to the cervix, uterosacral gets thickened, ureter gets pulled towards the cervix. As a result of it, in order to safeguard the ureter, in order to tick box it, make it safe, you need to open the pararectal space, both lateral as well as medial, and push the ureter laterally. From its abnormal anatomy, the ureter should be pushed in the lateral direction. This is a very important aspect in endometriosis surgeries. In fact, in surgery for endometriosis, this is the key point: opening of the pararectal space. When and where do you open? You open the pararectal space at the level of the sacral promontory. Okay. Simultaneously, which other cases? The other very important case is in cases of a hysterectomy. That means when you want to remove the uterus and you want to do uterine artery at origin. So whenever you want to go and coagulate the uterine artery here at the origin, Opening the pararectal space is going to be very important, but there you will get away by opening only the lateral pararectal space. So keep this in mind as students, because these are the important applications. And simultaneously, always people like to speak about the medial pararectal space. So yes, that is very important in all cases of nerve sparing surgeries. The reason why I say it is very important, because if I have to spare the nerves as we have drawn in the anatomy, let me just redo the anatomy for all of you a little, so you understand it very nicely. If I just cut off everything, you will understand out here that, see, the ureter is coming here like this. All right, but you have the hypogastric nerve which is going to go in the plane below there, and you have the uterosacral which is fanning up above it. So in order for you to protect this particular hypogastric nerve, opening of the medial pararectal space is very, very important. Obviously, once you see the videos of live surgeries, you will learn better, but any further questions we'll answer on WhatsApp. Thank you so much.